Good evening, viewers, and welcome to another interesting episode of your program, Healthy Living, coming to you from the Nigeria Television Authority, Nta Akure, the Dynamic Station. And I'm your host, Sonny Iradia Odiase. Today on the show, we'll be looking at another interesting topic, which is pregnancy-induced hypertension. Pregnancy-induced hypertension. We'll be looking at what is the meaning, what are the causes of the ailment, if there is any possible treatment for it. These are more we have for you on today's episode. Yes, welcome back from the break. If you are just tuning in from the Nigeria Television Authority, Nta Akure, today we'll be looking at pregnancy-induced hypertension. To throw more light on this very important topic is no other person than Mrs. Iziegbe Olabisi. She is a nurse by profession. You're welcome, ma'am.
Thank you.
Nice to have you in our program today.
Wow.
Pregnancy-induced hypertension. Like for me, I'm hearing it for the first time. So, ma'am, what is the meaning of pregnancy-induced hypertension?
Thank you very much. Pregnancy-induced hypertension is a raised in blood pressure in the second half of pregnancy. That is after 20 weeks of pregnancy. Then a patient might not have, as a matter of fact, the patient does not have raised blood pressure as an hypertension before that 20 weeks. But from that 20 weeks, the hypertension comes up. So that is when we now say the patient is having pregnancy-induced hypertension. The patient was not hypertensive, maybe before pregnancy or before that 20 weeks of pregnancy. So the hypertension just spring up at 20 weeks or above 20 weeks of pregnancy.
So you're not saying maybe the pregnancy, the hypertension was not there before the pregnancy.
Yes.
Suddenly, after 2 weeks or 20 weeks.
20 weeks.
20 weeks.
20 weeks.
It starts showing up.
Yes.
So it's somehow, what are the causes?
Actually, the causes is not really known. Like I said, it's something that comes up after 20 weeks. So actually, some people believe it is a pregnancy because after the pregnancy, shortly after the pregnancy, the hypertension goes down. You understand? So that is why the root cause is not known. Though there are some predisposing factor, there's some risk factor that can cause it. But the actual cause is not known.
The thing will just, spring up like that.
Yes.
Just like that. So it's surprising because, for me, I'm hearing it for the first time. And you're not saying...
And that is why it is called pregnancy-induced. Pregnancy-induced. It is caused by the pregnancy. And after the pregnancy, it goes up.
Does it, this ailment, does it really have any effect on the pregnant woman and
Yes.
the, unborn child?
Yes.
So if there is, what are these, effects?
There are so many effects on the mother and the fetus. Number one is for, before I go into the effects, let me quickly mention some types.
Okay.
We have gestational. That one does not really have a symptom. A patient might not know until he comes to the hospital and the blood pressure is checked.
Okay.
It is asymptomatic. We call it asymptomatic. And we have the preeclampsia. This one is symptomatic, and that one is when the patient comes into the hospital, the blood pressure is checked, and we discover it is above 140/90. Then the patient might come with headache, with nausea and vomiting, complaint of nausea and vomiting, or you just observe that the patient is a bit swollen. There's what we call edema of the face, edema of the leg, of the hand. Some people will tell you the patient is carrying twin. That is why the patient is blowing up.
Okay.
Whereas it is not. But what will make us to know that that patient is suffering from preeclampsia is when there are some factors, there are some things we observe in the urine. There's protein in the urine. There is raised blood pressure, which is the first indicator. Then there is the patient, like I said, the patient start having this swollen face and the leg. So, but the main indicator is when the patient has this protein in urine and blood vision. Blood vision. So this one shows that the patient is having preeclampsia. Now to the effect on the mother. Some, because of the ignorance, some might think because they are having headache, it is malaria that they're having. They won't go to the hospital. They will just start treating themselves with anti-malaria until when they get to the hospital and we discover that this patient is first, there is blood vision, there's likelihood of blindness, there is seizure, likelihood of seizure, which we call convulsion.
Okay.
And at that stage, that patient has already gone into eclampsia. Okay. There is stroke. There is what do we call it? Blindness, short-term blindness.
Okay.
To the mother. Now, some of them after, there was a time I had the patient, she had twin for days after the delivery. She could not see because of the effects. There's danger to the liver of the mother.
Okay.
There is PPH, okay, bleeding after delivery for the mothers. Okay. Then for the fetus, there is likelihood of intrauterine growth retardation. The baby will not
okay,
at age maybe 30. Inside will still be like a baby that is weeks or 30 weeks. So there's intrauterine growth retardation. Okay. There's likelihood of placenta abruption, that is the placenta separation before delivery. And at that stage, the patient will bleed. We call that one APH. The patient will bleed. There is intrauterine retardate, that is the baby will die in the womb. And there is the risk of premature delivery.
It's there
for the baby, because once the high blood pressure is not controlled, okay, you don't have any choice than for the baby to be delivered. So, and most times when the baby
delivered prematurely.
Yes.
Okay.
Delivered prematurely to save the life of the mother.
Okay.
You understand? So there is premature delivery, and more so there's risk of death, even for the baby that is born because of the prematurity, okay, if not well taken care of.
Okay, thank you very much. If you are just tuning in, this is Healthy Living from the Nigeria Television Authority, Nta Akure. And on the show, we've been discussing about pregnancy-induced hypertension. We will go for a break and we'll be right back. Please stay tuned. Welcome back from the break. I still have Madam in the house. Please, who can have this ailment?
the people that can have it, we have women of age under 20 years and above 35 years.
Okay.
It is common with teenager and elderly mothers above 35 years.
Okay.
Then it is common with first timer, we call them primary gravida, that have not been pregnant before. Then it is common with people that maybe they have the family history of people who had suffered from this ailment in the past. Then we have people that are having multiple pregnancy, carrying twin, carrying triplets. They have the tendency of having it. Then for some that just change husband.
I don't get it. Change husband.
Had children.
Okay.
And now did not have a new husband.
Okay.
So there is a tendency of them having it, of pregnancy-induced hypertension.
Okay.
So
one thing I see in it is that, this part of the world that we came from, people like humans, we don't take, our health seriously. And from what you're saying now, it's as if this sickness, let me use that word, it's very dangerous.
yes.
If I may ask, is there any role you feel that the husband to the woman, if they have a role to play, as in, in prevention,
I love a situation where the husband and the wife are so close.
Okay.
You understand? And make sure you monitor your wife, especially when they are pregnant.
Okay.
Let me cite an instance. There was a time we had a patient who eventually lost the patient before arrival. She complained of headache to the husband and blood vision, which was the history we had. The husband asked the wife to go to the hospital. But before the wife could leave, she convulsed and she was the only one at home. By the time the husband came in the evening, she missed the wife
Already
dead. So here we need the husband to support their wife, especially when your wife is complaining of a particular ailment. Oh, I'm feeling headache. It's like my eyes is not so bright. It's blur. Don't take it with levity. Don't just take it lightly. Ensure the woman goes to the hospital. If possible, follow her to the place. Take permission. Follow her to the place. By the time they examine her and they tell you she's okay, then when you observe your wife, you saw the woman you saw 2 days ago that was not so fat, and you discovered about a few days after, her eyes is puffy, the leg is puffy, is encourage her to visit the hospital. Let them examine her to be sure she's okay.
At times, most complaint has to do with, financial obligations. They'll tell you the money is not there. If I should take her to the hospital now, where will I get money, once drugs are prescribed? So don't you think the government have a role to play in this so that healthcare will be, cheaper and more accessible to people?
Yes, the government has a lot of role, especially with this our present situation in the country. And those appeal to the government to help our women, support pregnant women, maybe, and which I know the government is trying to subsidize health care for women, that they can easily access the health care. And thank God for the basic we have basic centers in our facilities. So I will encourage our
pregnant women and expectant mother, what they know about pregnancy-induced hypertension, and this is what I say.
Yeah, I fear it, but I don't. No, I don't have it. But they used to say it. They used to say it that some pregnant women have the hypertension, but I don't know. They said it that they is reduce the it can cause child depression. It prevents the baby inside the woman, and it can result to death.
I've heard people talking about it, and which is normal that once someone is pregnant, it brings out most of the diseases, most of the illness in the person body to push it out. So for someone who is hypertensive already, so when the person is pregnant, so the thing will push it out, it will be obvious and it's dangerous to the health of the mother and the baby. But this is one of the reasons for antenatal. So we come for antenatal every week, sometimes 2 weeks, just because we need to know the state of our health. So the earlier we know, the earlier the better, so that we'll be able to do the necessary measure so as to cure it or to give drug or measures that will be able to help the parents and the child from having anything that will cause life or the life of the child.
You normally go to hospital to check yourself. Whether if the hypertension is too much, then they will treat you. So I think we calm down before the delivery of the baby because it's very bad for pregnant women to get hypertension. It's not good. When they always they go hospital, check themselves. Number one, that BP is very bad. Always check your BP because once the BP is too high, it's very difficult. It's very difficult. It's not good. Just they take your antenatal drugs. They go hospital, check yourself. For any complaint, you go to hospital and tell them. They will know what to do.
Welcome back from that. Ma, is there any treatment at all? And if there is, what are these treatments?
The first treatment start from with the mothers, the pregnant women, early booking in the hospital. When they come to the hospital, they book early because some of our women in this part of the world, they always want to wait till the time of delivery before they come to the hospital.
Okay.
It shouldn't be.
Okay.
When they come to the hospital and book and register early, they will be monitored to ensure that if they have pregnancy induced hypertension, and from there the treatment will start. Okay. If they have this pregnancy induced hypertension, I said the other time that gestational hypertension might not have any symptoms. They will not know until their blood pressure is checked. So from there, be seen and placed on the normal treatment. Okay. And sometimes they are placed on bed rest. Okay. They will ask them to maybe admit them in the hospital for a while to rest themselves. And I would just want to encourage our mothers, when they are asked to rest, please take time to rest. Yes, I know Nigeria is good. Don't let us say something else. But please take time to rest because of the blood pressure. Then major treatments will be done in the hospital. They will be placed on drugs and monitored closely. Okay. And if the patient is when gestational hypertension is deteriorating to preeclampsia, that is when there is headache, where there is edema, where there is heartburn, where there is nausea and vomiting, and the patient is they might want to deliver the patient, the baby, earlier than expected. Okay, to save the life of both the mother and the child.
If I may ask this question now, if there are any preventions to this ailment?
Like I said the other time, since the cause is not known, we don't really have a particular prevention, but the major thing we need to do is early booking. Okay. So I will be able to discover it earlier. And be able to attack it earlier.
Okay, ma'am. Please, one last question. Please, what is your advice to the people of Ondo State pertaining to what we are just talking about?
My advice to protesters, especially our husbands, our parents, and the women, please, once you know you're pregnant or your loved one is pregnant, ensure those monitoring. Ensure they book in the hospital for them to monitor and ensure that they don't default the appointment. Okay. Once they are given appointments, But some people will tell you, nothing is wrong. I said the other time, now there is one that is asymptomatic, but can progress to if it is not well cared, taken care of. You understand? So you please book, register in the hospital, go for antenatal care, and whatever you are asked to do, please do.
Thank you very much. Next time we will call you. Viewers, this is where we call it a day on the show.